Hello, I'm Dr. Cheryl Holder. I'm a general internist and Executive Director of Florida Clinicians for Climate Action. Thank you, Presbyterian General Assembly, for inviting me to speak on my work on climate change in Dade County. For 4 decades, I've been doctoring in this community, in primarily low-wealth communities, from way north all the way down south to Homestead. Most recently, I'm in a clinic down south, a teaching health center, and I work with residents. And I'll just give you a snapshot of a patient, because that will give you a better understanding of how climate change is incorporated in what we do when we work with our patients. This older gentleman came in and he was for blood pressure and diabetes, combination problem, very common. And he was talking about a day that we were just saying, so what's your day like with your work? Because he was still working, he was in his 60s. And he says, well, I'm a maintenance assistant at an apartment community. And he does the pool and he does the garbage collection, he does all this outdoor work. And I'm like, God, it's been really hot. How have you been doing this? And he goes, tell me about it. The other day I was out there and I started feeling this cramp and I was so hot, I had to run into a storage unit to really cool down and drink my fluids. And I'm like, did you have any headaches? Were you feeling dizzy? And he goes, I was feeling like I was about to be dizzy, but I just got in and got out of that heat. And I'm like, you did the right thing. He didn't even realize. I said, you know, you were giving me signs what we call heat exhaustion. And that's really serious, because the next step, if you got headaches and you're getting confused, that would be a sign of a heat stroke, and that could kill, because heat is the #1 weather-related killer. And he was shocked. He didn't have any understanding. I said, I know, we don't talk about it enough. But we went on and helped him to see how he could change up his work schedule, see how he could talk to his employer to help him work a little differently. Because like all my patients who are out there, they're the ones you see on TV during the storms and the floods and the heat, that they're in the background of the cameraman scurrying to work or scurrying from home or something. And because they gotta work. My patient Jorge said it, rain or shine, cold or heat, I have to work. And it's with that understanding that when I see the patients and I tell them and they feel the heat and I see how the conditions have changed, and I let them understand, yes, it's hotter than normal, and the humidity and the increasing moisture in our planet has made this heat even more unbearable. And at lower temperatures, you could be really at risk. So we've been trying our best, but it's difficult in a population that has so little power. So it is so important for groups like the Presbyterian General Assembly to join in the movement, to understand that we have to speak up about what has happened to our planet, because it is putting many lives at risk right now. But if we're in a fortunate position where we have the time before our lives are seriously disrupted like theirs have been, we can get those policy changes and we can get those employers to understand what needs to be done now and what changes we need to be doing with fossil fuels and emissions to protect our planet as we're protecting our patients' lives. Climate change has happened. Our health has been impacted. Lots of extreme weather. It's hitting us emotionally. It's hitting us physically. Anyone with any kind of underlying diseases gets even worsened in their condition. Is that threat multiplier. But there's a lot we can do. And when my patients see other people doing this, that keeps giving them hope, and they keep doing everything necessary to survive, because we can do this together. Thank you.